In this video, I'll discuss a case of Bell's palsy. It was a 24-year-old female patient. She had an ear infection, and after a few days she developed the symptoms of Bell's palsy. Her main symptoms were her left eye, which she couldn't close completely, and the left side of her mouth, which was droopy. She had these symptoms for about 3 weeks before she came into the clinic.
Hi, if you'd like to learn more about the techniques that I talk about in this video and start using them in your clinical practice, check out the links in the description where you can see the full courses that I have available, both in English and in Portuguese.
I approached this problem with a mix of balanced method and master Tung Acupuncture. First step, I determined stomach and gallbladder to be the affected channels, and I saw obvious signs of wind. So my first approach was using bleeding, and for that I used her stomach and gallbladder channels as guides, and the first area I looked for veins was around stomach 35, and I bled all the veins in that area. After that, I went down to the area of Sesanli and also looked for any veins and bled all the veins I could find in that area. I kept going down to the area of the 3 weights, and again, every vein I could find, I bled. Finishing in the area of Mangin 6605 and gallbladder 41, and again, I did bleeding in this area, but afterwards I also needled these 2 points as guiding needles. After this part, I asked the patient to see if she could feel or see any difference, and she told me she could already almost close her eye completely, so she could see less light than she saw before while trying to close her eyes, and also smiling at a mirror. She was counting how many teeth she could see in the mirror while smiling, and it was more normal now. After this, I went to the opposite side arm, so on her right side, this was obviously her left leg, and I used the triple warmer and large intestine channels. I used Lingu and Dabai. I also looked for Ashi points near triple warmer 3, and I used 1110 Muho. After this, she told me she could completely close her eye and see absolutely no light with her eye closed. And looking at the mirror, she said that her smile looked almost normal, that she could still see a difference, but that it was much better. I left the needles in for 30 minutes and asked the patient to return the following day. After 24 hours, none of the symptoms had returned, so her eye could close completely, and her smile was better, but still not perfect. So I used the same idea for the treatment, but I didn't do any bleeding because I had done it the previous day. So I just needled 6605 and gallbladder 41. I also needled the 3 weights on the same side, and I went to the opposite side. I used exactly the same points, and I added Sanchasan. I left the needles in for around 30 minutes, and in the end of the appointment, the patient said that her smile again seemed better, but still not perfect. So we booked another appointment for 2 days after that. When she came in, again, none of the symptoms had returned, so we did the same idea of treatment, but I also added upper and lower lip on the area of her knee. I first bled these points, and then I needled them. And I kept the same points down here and the same points on the opposite hand. After this treatment, the patient said she could no longer find any difference in her smile, so it was normal, and her eye was also completely normal. So we stopped the treatment after 3 sessions with 100% improvement. When treating Bell's palsy or any kind of paralysis, especially caused by wind, I find that it's much easier to act as soon as possible. In this case, the patient had let the symptoms develop for about 3 weeks. Ideally, I tell my patients to try and book an appointment the day after, 2 days after, as soon as they can. Fortunately, we could still reverse all of the symptoms, and it was a successful case.
Thank you so much for watching this video. Don't forget to like and subscribe. Also, leave me in the comments suggestions for further videos, questions, anything I can help you with.